So, Dr. Merlino, how do you in the Cleveland Clinic define patient experience?
We define it as the care around the care. It is what the customer's perception of our organization is before they become a patient. It's what they see on the outside of our organization, the access to get in. It's the service around what we do for them while they're seeking a clinical service from us, and ultimately it is how we get them back to their beginning state, their state of health. And the challenge is to manage that 360.
That total process then, from beginning to the end. Okay. How do you measure the patient experience?
So we measure it a lot of ways, and we of course follow the standard measurement tools that Medicare tells us to follow with age caps and home health caps, and we also measure in the ambulatory setting and psychiatric services, pediatric services, emergency department services, and that's kind of the process metrics that we use. But we really dive down deeply with patient panels, and we explore their perceptions of the care, and we listen to what they tell us, what worked, what didn't work, and we drive it back to our leaders. We pay very close attention to our complaints, because I think they tell stories. And we drive complaints to all the leadership. And even though they're anecdotals, you can learn a lot from a patient who sends us a well-written 2-page letter describing what went wrong. And fortunately, it's not often the medical care that goes wrong, but it's the little indiscretions that tend to resonate with people. They didn't get their questions answered, or they had to wait for a test, or someone didn't treat their pain, or we didn't do a good job explaining things. So we pay very close attention to that. And we use transparency as a tool. We're very proud of the fact that if you call to complain, we action it. We get back to you, we send it to our managers, we follow up, we feel it's necessary, and we drive data around our process metrics to all of our management levels.
Talk a little more about how you use results to drive improvement inside the hospital.
Transparency is critical. We collect so much data in customer satisfaction, patient satisfaction, that we send it to the managers. We post it in the units. When my partner in patient experience, Sarah Sinclair, took over as the Executive Chief Nursing Officer in February of 2009, the first thing she did the first week was to start to post unit scores for age caps in each nurse